Hello. Oh, goodness. This computer system's having a bit of an issue, so we may have to stop here in the middle so they can repair some broken connections. But until then, we're going to give it our best effort. Now, what I'm going to give you today is everything you'll need for Exam 1. And you will be able to access this as many times as you want to. Look at the notes in class. I will give you a study guide probably this upcoming Tuesday. I'll create that for you guys and email it to everybody so that you have ample time to study before Exam 1. But we're going to talk about anxiety as we finished up with various topics. And anxiety, what exactly is it? You have to think about that. Most people look at anxiety as a fear of something. They assign a meaning to it, when in reality it's a fear of the unknown because you don't know what's going to happen. It's diagnostic when the problem interferes with ADLs, daily living. So there's some stats for you. 18% of the population has anxiety. Anxiety more prevalent in women and people younger than 45 years old. People are divorced or separated and lower socioeconomic class. So anxiety is prevalent. It's everywhere. It has to do with GABA. They believe the problem with the regulation of GABA occurs in anxiety disorders. Serotonin plays a part in OCD and in GAD, which is generalized anxiety disorder, which is a DSM-5 criteria disorder. There's a little bit about the epidemiology. You can look at that. You can look at the etiology of it. Sullivan, if you remember us talking about Sullivan viewed anxiety as being generated from problems in interpersonal relationships. Genetic susceptibility or vulnerability to anxiety they're suspecting that, but they really haven't found a malalignment in the genetic code. Generalized or general anxiety treatments, you want to make sure you keep them calm. Make them more aware of when they're getting anxious or worked up. You can help them by doing positive reframing. So you I can't even say the word. You make it less. Decastrophied, forget it. You make it less for them, less anxiety provoking. So you take it down to not the what's the worst thing that's going to happen, but come on down and say, how are you going to react to if this happens? So you kind of sit them up, they talk their way through. I said before in class, if you don't talk to yourself, you need to start. Okay, you're your best hero and you are your best enemy or worst enemy, and you want to be your best hero. I'm gonna practice that, I promise. Anyway, some of the things you can do, you can let them listen to music. You guys can use these too. Exercise, reassurance. If you do meditation, I practice meditation myself. It's very soothing. But that calm milieu, that calm environment is the best. Anxiety is ever present. The feeling of discomfort, terror, could be threats to physical or psychosocial integrity. And there's 4 degrees to it. There's mild anxiety, moderate anxiety, severe anxiety, and panic. And as you move through it, your perceptual field narrows. But I'm getting a little bit ahead of myself. Okay. And as you're going through it, your maladaptive coping mechanisms can actually make your anxiety worse if you're maladaptive, which you can see in someone with mental health issues that they can easily get to panic, which is the final stage of anxiety. Then there's the slide that talks about adaptive and maladaptive coping strategies, whereas adaptive promotes health, maladaptive promotes illness, and it just depends on how the person responds. It's the fight or flight again. Our body's pretty simple. It only has a few responses that are automatic that we are cognizant of, and of them, fight or flight is one that if you are thinking about your thinking while you're thinking, you might be able to control some of the symptomology. Now, The physical responses, maybe not. You're going to have elevated blood pressure, pulse, respirations, dilated pupils, the changes in the skin, cold climate skin, hyperventilation, restlessness, tremors, rapid speech, being very uncoordinated, and you can directly see that as an influence of norepinephrine, because that's where it hits all those receptor sites in your body. In case you don't recall your fight or flight response, that's what it is. Let's see. Cognitive responses to anxiety, impaired attention. When people are really anxious, they do not attend well to what's going on around them. Likewise, they can't concentrate, they forget things, they do some thought blocking where nothing's going to come out like that. They have a decreased perceptual field depending on their anxiety. And the next slide is wonderful because in everyday activity, your perceptual fields are way out here. I mean, I can still see my hands way out here. If I were anxious, it would come in a little bit more. I wouldn't be able to see, maybe over here behind me, if a little bit more here, a little bit more here. And extreme tunnel vision when you're panicked, which is why we do some of the nursing interventions that we do with panicked patients. I think oftentimes when you're driving on the interstate, the blind spot, the spot that you really don't see right here beside you, can actually, depending on the amount of traffic you have in there, become more and more broad as you become more and more anxious in the traffic. So kind of think of it like that. Let's see. That's a malfunction in the brain. That's what it is. Mild anxiety. So we'll go through the stages of anxiety. They're not that bad. Mild anxiety, you still get what's happening. You still understand it. You can identify what's disturbing you. You can work towards a goal. You can examine alternatives, experience a little bit of discomfort, irritability, and mild tension. This is where you should be. This is where you should be when you're getting ready to take an exam. Okay, you need a little bit of anxiety to get the juices flowing up there. You can still attend to what you're doing. You can focus. It sharpens your focus, in fact. Let's see. Yeah, you can hear, grasp information, problem solving. You might be a little uncomfortable. Some people are a little uncomfortable during exam times. They do a lot of the tension relieving behaviors. They crack their neck, they crack their fingers, they take deep breaths, and you should take deep breaths. I've said this before and I'll say it again. Every 7 to 10 questions, write yourself a line and a note that says breathe. Okay, so then breathe, sit back, stretch a little bit, and then go back at it. You need to maintain control over your anxiety. If you allow it to progress to the end of the exam, you're not going to be any good. Okay? Some of the interventions you can do, encourage them to talk about their feelings. If your patient's anxious, encourage them to problem solve. So you'll ask them, what did you do last time you were this anxious that helped to relieve the anxiety you were feeling? And then teach them some adaptive coping, some ways to cope, which is what I'm trying to do with you by encouraging you to do the stretching, the deep breathing during the anxiety to help take the edge off so the stress does not escalate. Next, there's a lovely picture of a gentleman. He's got all his stress-reducing strategies all around him. Stopping thought. That's one you can control. You may not think you can control it, but you can. If you are taking your exam and you've done 3 questions and you're in your mind, you're saying, oh my God, I don't know this, I didn't study this, oh my God, it's going to stop you from being successful. You're going to be sabotaging yourself. That is when you got a cue. Sit back, relax. Can't do a whole lot of these things, meditation or music or anything like that, but you can do some other stress relieving activities. Okay, exercise, eating correctly, getting enough sleep. That's a problem with college students. New babies, late work, staying up all night cramming, that's not going to help anybody. You need sleep. It's restorative. So make sure that you do rest before exams. You eat a good meal, good supper, a good lunch, good breakfast whenever your exam is. You can listen to relaxing music on your way in. When you get in there, just practice your relaxation techniques. Okay, things that will reduce your anxiety. Other adaptive coping, there's deep breathing, progressive relaxation. I do that myself with meditation. It's where you start at one part of your body and you move to the other parts of your body. You move down your body and you just kind of release the stress that you're feeling or the tension that you're feeling. Followed by meditation, mental imagery. By this point, I think most of you have probably imagined yourself walking across the stage and receiving your degree. If you have not, start doing that. It's going to help you see the end. It's going to help you focus in on that. It's going to help you strive towards that. And it's going to be a positive image that you need to put in your brain. Exercise, yes. Spirituality. Some people go to confession or they go and pray before an exam. If that works for you, go for it. Aromatherapies, massage therapies, bubble therapy. I told you I use that with my patients. Distraction. Reflexology. I've done this for a few students. It's pretty much on the foot. There's some pressure points to help to relieve anxiety, and I've done that when I've had a student who is near panic. One I can think in particular was almost in panic, and we did the nice little reflexology, and she relaxed quite a bit, and it was all good. She's a nurse now, by the way. So. Having a positive attitude, which is easier said than done, but you can. Seeking your goals, getting a second opinion. That's always good too. Make sure that you know all the information before you get started with anything. Let's see. Moderate anxiety. Again, like I told you, perceptual field. Here, mild anxiety, moderate anxiety. It's shortened up a little bit. You have selective inattention, so you're not paying attention to certain things at this point. Sometimes you need to have things pointed out. I think back to a student I had, bless her heart. She's a really good ICU nurse now, and I laugh about it because she's like, I can't believe I did that when I was in nursing school. I saw her at Kroger the other day, and I'm like, yeah. But we were going in to hang a piggyback. She was in. It used to be quarter, so fifth quarter, and we were going in together to hang a piggyback. And I look at the patient, because I always look at the patient. The first thing I do is look at the patient. And the patient is holding their chest, and they look at me and they go, I can't breathe. And we're on a cardiac floor, and there's sweat, and they're gray, and I'm like, oh, sugar beets. This person's having an MI. And she's over here fiddling with the pump, trying to figure out how to hang her piggyback. And I'm like, what are you doing, sweetheart? We got a problem here. And she's like, what? She couldn't hear me. It was selective inattention. She was so focused on the task at hand that she wasn't picking up what she needed to be picking up. And that was moderate anxiety that she was experiencing at the time. She really did not, when I brought her attention to him, she wasn't able to figure out what she needed to do next. Her problem solving was thought blocked. She was having a lot of shakiness in her voice. She was starting to get that sympathetic response, and I know she felt like she was going to puke. She just did not look well. And it was moderate anxiety that she was experiencing. And I got her out of the room. We called a rapid. And it was all good. But you can see how anxiety can take your focus away from what it needs to be on. And when you're in mental health, being anxious around these patients because of behaviors or just being scared by being there is going to narrow your field such that you might miss something that is crucial in the care of your patient or the safety of your patient. So you really got to learn how to relax. Let's see. Nursing intervention, same as for mild anxiety. You got to help them with problem solving, teach relaxation, and teach decision making once the crisis is over. Like that little girl of mine in the clinical, there was no learning anything until I got her out of there, sat down, and calmed down. And we already had the patient. I called the rapid. The patient was being taken care of, so that was the least of my concern. He was being taken care of. I needed to take care of my little student. She was really a mess. So once we did that, we were able to debrief, which I know we've talked about debriefing as being very important. I treated it as if it were a trauma situation for her. And like I said, she's a very successful nurse now because she learned to relax, and you need to also. Severe anxiety, I'm hoping a lot of you guys don't get into this. This is pathological. That perceptual field is really narrowed. Okay, they're here to fix the computer, so I'm going to shut it off for now. I'll be back.